Hi everyone, I'm Dr. Kristen Jacobs from Ooh La La Spa Anti-Aging and Wellness, and this is Real Talk with Doc, and I have the lovely Taylor RN and the lovely Jill RN and Carly, who's our nurse practitioner. And hopefully you've been watching all of our videos, their videos, and you've gotten to know them a little bit, but I thought we would talk to them live and talk about all the different things that they're doing now and all the things they're excited for, and just, you know, we'll just have a talk today. So thanks for joining.
You're welcome. You're talking to us.
I'm talking to you. Yeah, you right there. Yeah. Oh yeah, by the way, Taylor, you're here. So when I point to you, Jill, you're here, and Carly, you're there. So every time we do our Zoom meetings, I'm always pointing and they don't know who I'm pointing at. So, okay. So let's just talk about some of the projects that you're doing at your houses. I know we talked a little bit last week, but let's talk about the fun things that we get to do while being in this lovely quarantine.
So, been gardening, planting herbs and alfalfa sprouts, different things, making kombucha.
Really?
Yeah.
How do you do that?
So I actually did a video and I sent it to Steph. So
I haven't seen it yet. I can't wait.
yeah, so it's a fermented tea. Have you ever heard of it before?
No.
Or tried it?
Oh, kombucha? Yes,
Okay.
yes.
Okay. Yeah, it's very easy. So I just thought it'd be a fun video to do.
Cool.
What are
And
the
then I also
You have
drinking it?
fermented grapes more.
What'd you say?
What are the benefits of drinking kombucha?
So it's really good for your gut health. It has a lot of probiotics in it. So
It's
yeah.
good for after, a night of, imbibing. So it helps.
Carly gave me a tutorial over one of our one-on-one meetings. It was pretty cool.
Oh, I
Oh
can't.
yeah, I did show you.
Yeah.
Yeah.
Good. Well, I can't
And the
wait to
cool-
see it.
Yeah, and the cool thing about it is the SCOBY, which is the bacteria and yeast component of it that ferments the tea. You can share it with family and friends because it has babies.
Oh, really?
So I'll have to share some of those with you.
Okay. Good.
I know. So
So-
yeah.
So anything else exciting?
I've been working on my plant room. It's almost done. We just need a floor in there. So just been decorating and painting and that fun stuff,
Fun. All right. What about you, Jill?
So last weekend it was a lot of outside projects since the weather was finally nice again. Landscaping, we did a lot of landscaping, moving rock, mulch. We are going to redo our deck, so designing our deck, redoing some patio furniture.
Fun.
And some painting inside too. No kombucha here.
She needs to deliver that to us, I think, or I guess you could teach us how, and then we can make it ourselves. But delivering sounds more fun. What about you?
I feel like I've cooked more meals in the last month than I have in my whole life.
Oh, that doesn't sound fun at all.
No, although we are grilling out a lot, which makes things really easy because we'll throw something on the grill and a vegetable in, and it's done. Good. What about you, Tay?
I'm finished on my patio. So it's just like a stencil pattern on my concrete patio. So feels good to finally get that close to done. And then I'm just designing how I want my patio to look. So we're building a table. This weekend I ordered some chairs. So just getting that nice and pretty, and hopefully get to plant some flowers here soon.
I know.
We got an office set up, which when this first started, so I decorated that. We had a little gym set up, so I got to decorate that. I think that's it. Lots of walks, lots of baking and cooking. So
Fun. Lots of walks.
Where's your furniture from?
For my patio,
Yeah.
well, we're building the table. It's just like a farmhouse wood table.
Oh, you're actually building it.
Yeah, the chairs I just ordered from Target.
Okay. Cool.
Fun.
What
So,
about you?
well, we have been doing a lot of outside stuff as well, and we are hopefully getting ready to do what you're doing, Jill, and get rid of our deck and redo the patio in the backyard. But inside, I've repainted our little staircase that goes down into the basement from the game room. I redid the boys' laundry room, and I added some shelves in our master bedroom that I've been wanting to do, and then decorated that. So doesn't it just feel so great to get some of these projects done? I mean, I don't know how any of us are going to go back to work. But maybe we'll get all our projects done and then we have to go back to work. Maybe that's what it is. So I'm just excited about the weather finally getting nice, although it's supposed to rain this weekend. But, getting outside, and I power washed the house over the weekend because I want to paint it. So that's going to be my big project in the next nice, few days after the rain, and hopefully have a new, pretty updated home. So that's what we've been doing. What's that?
Are you going to paint the house yourself?
Possibly, yes. I haven't worked myself up to saying yes yet, but probably.
color?
So, a gray. So we're debating on which gray. I'll have to send you pictures. You guys can vote. We'll do that and see which one you like better. Yeah. So, all right. So, I'm so thankful you've been doing all of the videos that you've been doing. What's been your favorite video to do?
My favorite was, and I guess this wasn't just me, it was the team, but I loved the Unforgettable Brush video. I thought it turned out so cute.
I love that video. I think that is by far the best thing we've ever done. And I feel like Steph does such an amazing job with marketing, but that one by far was the most fun we've ever done, and just so cute. And little Leo, oh my gosh, he's a mess.
I love the music with it was really cute. She just did a really good job.
She did, yeah. And the Unforgettable Brush was just named the best powder sunscreen best brush. I think she has it on our Instagram story today. So that's so exciting. So for those of you thank you, Carly. Look at you go. You knew I was going to ask some tough questions here. So for
I know, I'm gonna fly.
good. So why don't you talk about it for a minute, Miss Carly?
So I love this brush just because it's so convenient, it's so easy to use, and like everybody has said before, there's no residue on your hands. You don't have to touch the product. You don't have to touch your face. It's just a brush. My husband Ryan, he uses it every day.
Good.
I don't let him have this one because it's the only one I have, but I will get him one, and he'll keep it in his car, that kind of thing, in the glove box, and just reapply it at work. So.
Well, good. And I love that your husband's using them. I think that's really important. We have family packs at the office too, so it's buy two get one free for that, and that's exactly what most families should do. In fact, I'm going to try to stand up here because when I was putting my shirt on today, so protect your family. Yeah, it's really our May is Skin Cancer Awareness Month, so I'm starting to prep for that. But then I realized that this is so, like right now, this time we're trying to protect our families so much anyway with the whole Corona thing. But we're going to start getting into the May is Skin Cancer Awareness Month and talking about all of our sunscreens. And that, to me, is one of the best months as far as education goes. Last year, we posted something every single day about some kind of sunscreen and some kind of education. And the Unforgettable Brush absolutely makes it the most convenient way to reapply. But for my kids, they just use it as their first application as well. So love it. So I don't know which, you've all done such amazing videos. I think the short and sweet video that Jill did with the retinol was so informative because that's a product that everybody should be on. So I really liked that. Tay, I saw your acne one the other day, and I thought that was great. And I can't remember what you said in it, but it was so cute. All of your videos have been all three of you have been great. And then, Carly is new to Ooh La La and new to the whole aesthetic industry. So how amazing have her videos been? for somebody who is just kind of like, okay, do it, get in there and do it, let's go. And she's really stepped up and enjoyed it. So is there one that you've liked, Carly? I know it was hard for you in the beginning to do videos, but what?
Well, I did the diamond glow one just because I've done that procedure a few times and I've had it done and I really like it. So when you know about something, you know, it's easier to talk about. And then I do love the HA5. So that was pretty easy to talk about just because, you know, I was passionate about it. So.
Right. So for this isn't really even a skincare question, but for those who are trying to do videos and even, I mean, not necessarily live, but just do videos, what's your best advice you would give to somebody just starting off?
Just whatever you're passionate about, just start talking about it. I mean, people, like you had said, people want you to be real. They don't want you to be scripted. So it's just kind of, hey, if you kind of mess up, just keep going, you know, because that's real life, you know, so.
It is. I mean, I'd love to say that we're all perfect, but we're not. And so it really is just easier to just let it go. And like you said, the passion, when you're passionate about something, it's easy to talk about. So I think that's key, especially in this time when everybody's trying to stay out there and get their message across without being able to see people, you know, one-on-one. So I think that's great.
Just educating, you know, when you're educating about something that you know about, then it's pretty easy to talk about.
It is.
So.
It is very easy. So anything to add on that stuff? No. No, you're like, no. So you mentioned Diamond Glow, Carly, and I know that's one of my favorite treatments. So I think that we're going to have like a whole line of people out the door trying to get in to get their Diamond Glow as soon as we get back in. And why do you love it so much?
So I love it because it exfoliates, it extracts, and it infuses different serums. So it is a little bit more medical grade and deeper, so it does really feel like, you know, you're getting rid of the blackheads and the dirt and the debris, but at the same time, it's not abrasive, so, I mean, there's no downtime with it. And then the serums that Diamond Glow has, there's one for pore clarifying, there's the hydrating one, there's the antioxidant one, and then the skin brightening one. So, I mean, it's pretty good for any skin type, you know. So it's a nice treatment overall.
Good. Do you guys want to add anything to that? You guys are being so quiet. We're making Carly do all the work here.
What kind of brain busting do you have here? No, and I love, like, you know, giving the treatment, you know, because it is relaxing and you can just sit there and talk with the patient and, you know, I like it.
Good.
And I like the post-procedure products, too.
No kidding. Yes.
Yeah.
You had mentioned the line out the door, and as I put on a little bit of makeup before this call, I thought, man, I could really use a Diamond Glow. So I know.
I know.
If I'm thinking it, then surely the patients are still thinking the same thing.
Absolutely. And I love it for the hydration. I mean, it just is a game changer, I think. And then my boys use it as for the acne treatment. And I just think that it does such an amazing job, like you said, on anybody's skin. But that is by far, I mean, I love all of our treatments, but by far, I think that's the one that I love the most. I say that very cautiously because, of course, I love my old therapy. You know, I love it all. So let's talk about that. Besides Diamond Glow, Taylor, what's your favorite treatment to get and your favorite treatment to do for patients?
My favorite treatment to get is Botox.
Okay.
And what is my favorite treatment to get? I love them all, but I really love Limelight with microneedling and PRP, just because it hits a little bit of everything. So brown spots with the Limelight or redness, and then stimulating collagen, whether that's for fine lines or pore size or acne scars or anything like that. You just kind of hit on every concern with that. And even if you don't have any of those things, like you don't have lines or scars or large pores, it's just great to maintain and stimulate collagen. And we all have a little bit of skin damage underneath the surface, so even if you don't have brown spots on the surface, limelight could still benefit. So that's my favorite to give, probably.
Okay. Yeah, I love the combination, and I think you see results pretty fast with that. And I think, like, when I love Botox because you are going to see results within a couple weeks, filler because you see it immediately. So when I said old therapy, obviously that's more of a long-term kind of thing where we're stimulating collagen. I love it because I feel like it helps to maintain and it stops that clock from rolling, stops the aging process. But I do think that for our patients, it's better. Not better, but it's great to do both long term and the short term because you really want to see those results. So, what about you, Jill?
So my favorite treatment to get is microneedling as well. I did one in January and one in February, and I missed my March one because of all this craziness. But I could tell a huge difference with my skin after those two. And the cool thing is it really helped with my hormonal acne, pore size, and I really battle hyperpigmentation from melasma, and it broke that up as well. So I can't wait to get the third one. And then my favorite treatment to give is Secret RF. It's basically taken that microneedling and taken it to a whole new level and combining it with radiofrequency heat. So we like to say it's like our microneedling and thermi on steroids because it does so much more for you. And I love that treatment because, again, it treats a huge range of things and basically will hit on everything that the patient is looking for to help improve their skin.
Yeah, I think that I have to change from Diamond Glow as my favorite to Secret as my favorite. So, I'll change it 15 times through this whole talk because I love them all. But I definitely love the Secret RF because you do see immediate results with that. Within a couple of days, you see some really nice results. And then, of course, it's going to be more long-term. So I think even maybe adding some limelight with that to help with the brown spots a little bit more is excellent. Or PRP, the platelet-rich plasma, which helps that collagen stimulation. So I think that's the fun part. One of the fun parts about our job is that we have so many options and have so many combinations, and it's fun to see the change in the skin and to, like you mentioned, it's helping that one treatment, it's helping your melasma, your hormonal acne, your texture, everything. I mean, your skin looks amazing. And that's what's so exciting about it is seeing the changes and seeing the results that we can give. Because I think it's very important. We all know that how we look makes us feel better on the inside. And I don't think that it's necessarily vanity to want to look good. And even something as simple as doing Botox can change the way you feel about yourself and the way you look. And I think that's really important in this day and age and, any time. But I want to look good. I want to feel good. Why we exercise, why we've been outside, during this whole thing. I think it feels so much better to walk outside than to be stuck in even though our offices are beautiful. I love my office and it makes me very happy, but I do like to just get outside. So I feel like it's the same kind of thing. So, Carly, I know you haven't gotten to do the treatments yet because you started on right before all this happened, but what do you think is going to be your favorite?
So I'm really anxious to try the microneedling, just with the hyperpigmentation from acne and some brown spots, that kind of thing.
Mm-hmm.
And maybe the Secret RF. I think that one's really, really cool. I like to watch it be given too.
So as with everybody else in our situation, we're all doing webinars and trainings, and I feel that our team has really taken advantage of this time and has learned so much over the last several weeks. And this, I'm putting you on the spot, but is there anything that really stands out that you can't wait to share with the patients when we get back in?
my favorite part of my favorite webinars. A lot of them have been so good.
They
There's
have
just some information out there, but I have really enjoyed the Allergan Medical Institute ones, and those mostly focus on all of our injectables. But there's just so much out there, and it's so exciting to hear about everything and what's coming and what we can do differently to even improve things more. So those have been my favorite.
Good. What about you, Tay?
Like Jill said, they've all been really, really good. I love to refresh on product knowledge, and I love the injectable ones too, just to learn. There's so many things to learn that, you think you know, but then you listen to one of these and you're like, oh, wow, I had no idea. So it's nice to refresh on that and refresh on like the facial muscles and how the face ages. You know this stuff, but how often do we get to just sit down and re-educate ourselves on the things that we, learned years ago? So that's been really exciting. I'm excited to put all that back to work.
I agree. I mean, we, you get so caught up in the day-to-day at the office and, getting to the patients and creating these results, but sometimes it's just nice to take a step back and go back to the basics. And like you said, the anatomy and why the skin ages and why our face ages. And we have been working as a team really hard to create all these new protocols that we can help our patients even better. So I'm really excited about it. For me, I agree. I love the Allergan Medical Institute. The one yesterday was outstanding, and it was more on the patient experience. And I feel like we do an amazing job with patient experience, but I always, and you guys know, I always want to do better. And I always want our patients to feel 100% comfortable coming in and know that they're loved and that we really do care about them. For some, it's a safe place. And so I really enjoyed it yesterday because it was, what else can we do to make it even better? And if, besides the fact that we've completely redecorated the place, which, for those watching, I can't wait for you to see it. That excites me as well. But just hopefully some other little touch points that we are going to be helping our patients, and some extra educational materials and handouts that we've been working on. So I think that all of you that are watching are going to be really excited to get back in. And, we all know we love the treatments, but just to see the progress that the team has made. And I am extremely proud of the entire team. And we'll have we have half today, and we'll have the other half next week just to talk about some of the administrative stuff. But very proud of each and every one of you guys and them just for taking this and running with it and learning and educating and not just being like, I know it all, but that's why we have such a great team. So, Carly, what about you? I know everything is new to you, but what are you most excited about?
Well, I love all of the webinars that have been going on, just like Jill and Taylor have said, and a lot about the products, just because, you have so many great products with Color Science and Skin Medica, so it's just nice to see them and hear about it from the experts, and then also about the actual patient experience and how to educate patients more. If somebody comes in for Botox, it's not just about Botox. It's going to be the whole being. We're going to look at, your facial structure, a lot of patients don't know that. They don't know about their, fat pads getting lost over time and their muscles and skin laxity and different things. So I think it's just that whole education piece to when the patient arrives. So.
Mm-hmm. I think the more we educate, the more excited we get, and obviously the better outcomes and results for our patients. So I think that's great. We are getting close to being almost to our the end of the show. So I have a few more things that I want to talk about, but is there anything else that you want to add before I talk about some of the other things that we have going on? Nothing? Okay, so what I didn't answer earlier about what my favorite video was, and you'll all laugh, besides this unforgettable brush video, but it was the Dyson hairdryer video. Like, I I absolutely, I mean, I didn't even think that would really do a whole lot. And everybody has been so excited about it. And so that's why we decided to give one away. And I think everybody deserves it and every mom deserves it, but only one person is going to, get to win it. So if you're watching, if you want to learn how to enter in, follow us on or like us on Facebook. You guys help me out with all the young garbage jargon here, but like us on Facebook, follow us on Instagram, and if you like the post, share the post, comment on the post, you can enter. We have some great packages that we put together, and that's one of the things. I'm going to actually move this around so you can see. Oops. This one is for sensitive skin, and then we have regular skin and acne-prone skin, and then we have a at-home facial treatment. I forgot to put that one over here, but that one was really fun. We watched that video, or we did that video last week on how to do that, the at-home facial. But these are all 30% off, and the at-home facial one, though, that's more like 50% off. Hold on, we don't want to upgrade yet. It's more like 50% off. So that package is $490, and we're getting it out there for $199. So buying those packages gets you an entry, and then also our Mother's Day email is going to be coming out next week. So buying your mom a gift card can enter you and your mom into it if you give her information as well. So, like I said, that's been one of my most fun and exciting videos that I really didn't even think twice about it. I'm just like, well, this is how you do it, and I love the Dyson, so I think I need to be a spokesperson for them for sure. So,
Start sending you PR packages.
What's that?
Maybe they'll start sending you PR packages to promote their product.
I think they should. I think we should get one for every team member. Dyson. I mean, I'll push for that for sure. So, but anyway, I think just the reason I wanted to have you on is just so that you're still out there and everybody can meet Carly and see you girls, and just to talk about all the exciting things that we have going on, even though we're at home. So I want to thank you from the bottom of my heart for working as hard as you have, and for learning and educating and just becoming better providers for our patients. So if you have any closing comments, you should say, I don't know, something.
I will say the three of us in our group, we've got a group text string going, and I think we've collectively decided that it is a great thing that we don't work an office job, and dying to get back in the office and see patients again.
Okay. Good. I am too.
I can't sit behind a computer all day, every day.
Right. It does make it exciting at the office, because you don't know, it's not the same thing every single time you walk into a door, and it's really a fun job. I just absolutely feel so blessed. I really love it. So, all right, Miss Carly, closing comments here.
Wear your sunscreen.
There you go. There you go.
But but seriously, I can't wait to get back in there and start on these treatments and get learning and see everybody. So.
Good. All right. Well, thanks for joining, you guys, and I'll see you on our next webinar. So have a great day.
Thank you.
Okay.
Bye.
Bye.